WQAD News 8, this is WQAD This Week.
Good morning. It's Sunday, May 14th. Thank you for joining us for News 8 This Week. I'm Jon Diaz. May is Mental Health Awareness Month, and this morning we are focusing on the mental health of people caring for those suffering from Alzheimer's. Millions of people across the country are caregivers. It's a role and responsibility that can have physical, mental, and emotional impacts. This morning, we're looking at signs to watch out for and things you can do even if right now you're not a caregiver. And joining us now is Charles Fuschillo, the president, CEO of the Alzheimer's Foundation of America. Charles, thanks so much for taking the time this week.
Well, thanks for having me on.
Of course. I want to just start by understanding the scope of sort of caregivers and what and how many caregivers are out there. And then if you could talk about the challenges they are facing that relate to their mental health.
So there are millions and millions of caregivers that are out there. And, in your state, there's more than 230,000 people that are living with Alzheimer's disease. Use a multiplier of 3 or 4 for a caregiving team, and you can see how widespread and prevalent it is. But throughout the entire nation, there's more than 6.2 million people living with Alzheimer's disease. And now use a multiplier of 3 or 4, and you can see the tens of millions of people, how this is affected. We always like to talk about, our heroes, which are the caregivers when they're caring for somebody with Alzheimer's disease or related dementia. They are the front line. That really takes care of people that are infected with this disease.
And what are they sort of dealing with in terms of their mental health, in terms of maybe the feelings that develop when they are charged with caring for a loved one?
Emotional and physical stress that can be overwhelming. Isolation, even though they're with somebody, they could be isolated because they're by themselves, feeling tired all the time from just caring for somebody, not taking care of themselves. They could experience weight loss or weight gain, no physical activity, and emptiness because they're really by themselves. So here's what we do. We say, hey, take a time out. You need to care for yourself as well.
Can you help us understand? And I don't mean to ask sort of an obvious question, but I think it's important to identify maybe the problem, if you will. What causes this to happen? Why are these feelings and everything you just described happening in that dynamic?
So when you're caring for somebody, let's go back to the pandemic when COVID hit us. Caregivers were dealing with stay-at-home orders, isolation and loneliness, even while they're caring for somebody because they didn't have the opportunity to reach out. We used to say to people, touch somebody by electronically, telephone, or having somebody even come to your house and outside. But while you're caring for somebody that has a neurological disorder, cognitive impairment, you yourself could feel isolated, can feel many different symptoms of depression without even knowing it.
What are some of the things that folks can do very actively and maybe very simply that could help alleviate all that?
Take time out for yourself, in your schedule while caring for somebody. Get a little respite relief as well. Whether you're a professional or just a caregiving team of family members, you need a team. You can't go on this journey alone. First and foremost, we always tell individuals, reach out for support, whether it's the Alzheimer's Foundation of America's helpline, which is staffed by licensed social workers that are dementia specifically trained. You may be going through a situation that you're not able to handle. It's always good to reach out for help. Put 30 minutes at a very minimum of time off for yourself so you can just go for a walk, take care of your body and your mind as well.
I know this is a little bit out of the scope of what we're talking about, but I do want to lean on your expertise on something.
Sure.
When it comes to being a caregiver, oftentimes I imagine it's not an overnight thing, it's a gradual thing, especially if we're talking about adult children caring for aging parents. Can you talk a little bit about what folks can be doing early on in that process if they've identified that, hey, they're doing a few more things for mom and dad these days? What are some smart steps and smart ways to be thinking about this sort of shift in the paradigm of what maybe you're used to your entire life?
reach out for help, speak to those that have gone through this, that have the experience that's necessary to prepare you for what the journey will be as a caregiver. And I'm going to go back to what I said, reach out to the AFA helpline. And that's a toll-free number, 866-232-8484. Talk to our professionals that have the experience to help caregivers get through this journey. But first and foremost, after that, develop a team. You need a team of caregivers to help you get through this, because you can't do this alone. And once you develop a team and divide up the responsibilities, it will help you enable getting through the caregiver journey.
A great practical step there. Charles, thank you so much for taking the time this week to chat with us.
Thanks so much for having me on.